Yes, you're on to another interesting episode of Health Watch, reaching you on your number one station, NTA Lagos Channel 10, the station for excellence. Today, we're talking about a health condition that has been described as a silent killer, which is also known as hypertension. Sadly, this is also affecting people of the younger age groups. And today we've brought a guest that will telling us all we need to know about the risk factors, but how to manage this health condition. And of course, we know that hypertension could also mean that your blood pressure is high. All of this you'll find out on this edition of the program. Plus, we have a segment on the importance of exercise. We cannot overemphasize the importance of exercise in our daily life. My name is Nkem or Kibi. We'll go on a short break. When we return, you'll make my guest stay with us.
For high blood pressure, put your feet in warm water for 5 to 10 minutes.
To immediately lower the blood pressure, you need lemons and mineral water.
Prepare the lemon. Pour the mineral water
And squeeze the lemon inside. You can use 1 lemon per 1 cup of water. 1 complete lemon. So I'm going to squeeze this one in too. Stir and drink. A lemon mineral water along with warm foot bath would considerably lower your blood pressure, and it will do it very fast, like in a couple of minutes.
Then the program is still Health Watch. Just like I said before we went on the break, our topic today is on the silent killer known as hypertension. And my guest today is no other person than Dr. Oluchi Ogwuma, a general practitioner that has been in this field for over 30 years. You're welcome to the program.
Thank you very much.
Talking about the silent killer, first we'd like to know, why is it called a silent killer?
It is called a silent killer because it is silent in the sense that most times it doesn't have symptoms. So you see people coming to the hospital, or when you come for another ailment, maybe for complaint of high temperature.
Okay.
Normally we're going to take your vitals before we now start other things. During the time the vitals are being taken, somebody's BP will be measured, and before you know it, you find out the person has hypertension, and he doesn't have any complaint concerning hypertension. Sometimes you just see people drop, and they say this person was okay, before you know it, he just dropped and died. So then you see some other people come down with stroke. Before you know it, they ask them to say, I didn't know I had hypertension. So that is why it is called a silent killer.
Okay, to the layman, what do you describe as hypertension? How do you describe it? Because everybody just says, I'm hot-tempered, I'm this. And some people even think that is hypertension. So it's very possible that a lot of people on the streets don't understand that the silent killer is also known as hypertension. So tell us.
Hypertension is elevation of the pressure in the blood vessels above normal. And what is normal? Normal is 119 systolic, that's upper, listen, 119 millimeter mercury, the upper number, over less than 80 millimeter mercury, the diastolic, which is the lower one. That is normal. Anything above that is hypertension. It's hypertension, which means that's high pressure of the blood vessels. Though we have what we call staging or categories of hypertension. According to American College of Cardiology, they have categorize the hypertension levels. Elevated one is the first one is elevated, or let's say the norm, which I have described, the normal one. Second one is elevated hypertension. From elevated hypertension, we now start seeing that the blood pressure is elevated.
Okay.
Now, what is elevated? One in the group of elevated blood pressure, 120 to 129 millimeter mercury, the upper side, and the lower side is 80 to 89, the lower side. That is elevated BP. Then stage 1 is the one from 130 to 139. Okay, of the that's systolic, 139 millimeter mercury, and the lower is 80 to 90 millimeter mercury. Then the stage 2 is from 140 and above. That's stage 2, 140 and above for the systolic blood pressure, and for the diastolic it is 90 and above. So that is for that class, categorization by the American College of Cardiology.
At this point, I would like to talk about the causes, because when you have really been able to tell us the types, and it's obvious that from the primary, some people could just be hypertensive by their nature.
Yes.
Okay, but now we're talking about what are the major causes of hypertension.
Especially the essential, which is the primary, okay, which you say it doesn't have specific cause. Most times it's genetics, kind of inherited from your foreparents. Okay, there's a gene that has been inherited. Now, it may not express itself. The gene may not express itself. The hypertensive gene may not express itself. But when it is placed under some kind of conditions, like lifestyle activities, like smoking, drinking much alcohol, stress, too much stress, and not exercise. If you are not exercising, that's where you see, oh, it's not specific. It's something that will now bring out the hypertension gene in that person. You can see somebody, maybe they are twin, they inherited the gene. One in life will have the hypertension expressed because of that type of lifestyle the person is having. The other twin will not have it because of his or her own lifestyle. Okay, maybe the one of these twins that didn't have it is doing exercise. Is involved in doing exercise in life. It's not involved in taking alcohol, high dose alcohol. It's not obese. Okay, you watch what you eat, all those things. So those are the one that is in primary hypertension. Okay, but in secondary, you see things like narrowing of the vessels of the kidney, the vessels that take blood in and out of kidney, especially the vessel, the artery that takes blood into the kidney, narrowing of it. Most time caused by maybe something like the type of life the person lives. Take a lot of fatty things that leads to causing of plaque in the blood vessel. Okay. So that's one of the ones that you see secondary hypertension. Then, we also have narrowing of the big vessel we call the aorta. Okay, if you have stenosis of the aorta, you can have also hypertension because it's narrowed. It's the major vessel that takes blood from the heart to distribute to the other parts of the body, especially the lower parts of the body. So if it is narrowed, there will be tension in the heart pressure. Like we have preeclampsia in some pregnant women. Some of them will come to somebody that has normal blood pressure. Getting pregnant, the blood pressure becomes high. On delivery, most times the blood pressure will come down, normalize. Or if the blood pressure is too high to cause problem and the pregnancy is terminated, the blood pressure comes back to normal. Okay.
So you are saying it's very dangerous.
It's very dangerous. It's the one we normally leave in the hands of the specialist. Things in the secondary, like problems with the hormones, the adrenal hormone. When the adrenal hormone is discharging high, or what you call hyperadrenalism. There's also hypertension. When the problem is treated, the person gets better.
Is there a thin line between causes and risk factors? So you say, okay, because you're obese, you might likely be hypertensive. Okay? So is there anything like that? Are there risk factors to look out for that could put that person at a situation where you might be hypertensive?
This factor as in lifestyle of a person. Like if alcoholism as a risk factor, it's not checked. If the person doesn't check his intake of alcohol as a risk factor, then the hypertension will keep going on and on. If as a risk factor, if age, which is one of the risk factors, and at that age you don't even care about measuring your blood pressure. If you don't care about measuring your blood pressure, you find out that it will keep going on until it causes damage. Then other things like salt intake, high salt intake. If you are taking too much salt is one of the risk factors of it.
When you say salt, you mean salt intake in your food?
In your food.
Definitely, yes. I don't think anybody just takes salt to eat. But I'm saying some people they cook their food, their meals, and during while they are eating their food, they just say, oh, let's add salt. Is that the kind of salt intake you're talking about?
If you are somebody that consumes much salt in the food, like everybody is served food in a house, you find a particular person putting adding salt into his own. Okay? That person should be checked. Should be careful. We should be sure that this person doesn't have hypertension. Okay? Because it's a risk factor.
Alright, doctor, at this point we'll go on a short break. When we return, you'll be telling us what are the possible complications that may arise if you do not take care of yourself, if you do not know, if you're not aware that you are hypertensive. We'll go on that short break and we'll be right back. Health Watch continues. Stay with us. You're welcome back. The program is still Health Watch, reaching you on the station for Excellence NTA Lagos Channel 10. And today we're talking about hypertension. Our guest is still in the house, in the person of Dr. Oluchi Ogwuma. Okay, so before we went on the break, you've been able to analyze the causes and, of course, be able to differentiate risk factors. Now, the question would be, what are the potential complications that may arise from untreated hypertension?
Complications of hypertension. One is heart failure. Okay? When the heart has been working under pressure, at the time the muscles becomes weaker as the blood they are pushing out. We have heart attack, we have stroke, we have also complications of the kidney, can lead to kidney failure.
Thank you very much, doctor. So what would you say are the management measures to respond to this health condition?
Management is, first of all, you would have started management when you find out that you have your blood pressure has passed this range, which I mentioned. The first management is seeing the doctor. Okay, the doctor will now check your level and know what to tell you, whether you're going to go on lifestyle modification, which includes having regular physical exercise or changing your habit concerning the intake of certain foods. Also, if the person is smoking cigarettes, can be cancelled to stop smoking. If the person is taking high dose of alcohol, can also be cancelled to stop taking alcohol or to reduce. That's for the aspect of lifestyle modification. Then, if it's a stage where one should be placed under drug, there are drugs that takes care of high blood pressure. They reduce high blood pressure. There are different types of drugs. The doctor will know which type or how many of those types that is okay for a particular individual.
I know that a lot of people do not understand when that silent killer crawls in, and now you have made it so clear to us. Most importantly, if your BP is over 120/80, see your doctor, right? So we've been speaking with Dr. Oluchi Ogwuma. Thank you so much for coming on the program.
Thank you for having me.
All right, moving on, our segment this week is talking about the importance of exercise. And you agree with me that doctor said a whole lot about how to manage hypertension. And look at this feature. This is one of the ways to manage hypertension. We'll be right back.
Yeah, let's look at the meaning of exercise. Yeah, exercise has a lot of meaning, but I think I want to go with this one. It has physical effort for what? For us to be able to do what? Improve our health and fitness. Exercise will help you increase your mood. It will decrease your feeling of what? Depression, anxiety, and stress level. So exercise will also help us to strengthen our bones and muscles. Remember, we are all trying to make sure that physical aspect is being brought in, and that will help us to strengthen muscles and bone. Exercise can help also in relaxation and sleep quality. Sleep better and relax more better. Because when we engage in physical activities, our energy level will increase. So it helps to do what? Increase our energy level.
And that's the much we can take on this edition of Health Watch. Remember that I normally say health conscious people live longer. You've heard it today. If you have this device to check your BP at home, anytime you feel it's low or it's high, please do not conceal it to yourself. Reach out to your doctor. It's very important. My name is Nkem Okibe. So come again next week. See you till then. Bye.